cheeks,
Now.
and chin to assess all three divisions of the nerve.
Now.
Good. Open your eyes.
If the person has abnormal facial sensations or movement, test the corneal reflex. While he looks forward, bring a cotton wisp in from the side and lightly touch his cornea. Normally, he will blink both eyes.
You won't need to do that.
To test cranial nerve 7, the facial nerve,
Checking cranial nerves.
begin with motor function.
I need for you to do some facial expressions.
Note mobility and facial symmetry as the person smiles,
Frown.
frowns,
Show your teeth.
shows his teeth,
I need for you to raise your eyebrows.
lifts his eyebrows, closes his eyes tightly against your attempt to open them, and puffs out his cheeks.
What I need you to do is try to puff out your
Then
cheeks.
press his cheeks
I need you to
in.
try to push them in.
The air should escape equally from both sides.
Good.
Next, test cranial nerve
Okay, now
8,
we're gonna check
the
your
acoustic
cranial
nerve,
nerve.
by assessing hearing acuity during normal conversation.
All right.
As you would during an ear examination, also perform the voice test, in which the person should be able to repeat each word after you whisper it.
Friday.
Friday.
Armchair.
Armchair.
Good.
The Weber test, in which he should hear a tuning fork tone equally in both ears.
Now, if you can hear it in both ears or one ear.
All right. Both.
Good. Now
And the Rinna test,
place it
in
behind
which he should hear a tuning fork longer near the ear by air conduction,
Then I'm gonna-
then through the mastoid process by bone conduction.
When you stop hearing it, I sing it down.
Okay. Now. Now.
Now test the motor function of cranial nerves 9 and 10. First, depress the tongue with a tongue blade and have the person say ah. The uvula and soft palate should rise in the midline, and the tonsillar pillars should move symmetrically. Then touch the posterior pharyngeal wall with a tongue blade to elicit the gag reflex. Also note that the voice should sound smooth and not strained.
Okay, sorry about that. Now what we're going to do is check cranial nerve 11. Okay, I need to look at your neck and your shoulders. So I'm going to undo your gown.
Okay.
To assess cranial nerve 11, the spinal accessory nerve, examine the sternomastoid and trapezius muscles. They should be equal in size. Also test for muscle strength in 2 ways.
What I need for you to do now is just look straight ahead for me. And
Ask
we're
the
gonna
person
do-
to turn his head against your resistance at the side of his chin.
Okay.
Okay. Good.
Then ask him to shrug his shoulders against your resistance.
Resistance from my hand.
These movements should feel equally strong on both sides. Finally, assess cranial nerve 12, the hypoglossal nerve.
Which is
First, inspect the tongue, which should have no wasting or tremors.
Look at your tongue.
Then ask the person to protrude his tongue, which should thrust forward in the midline.
Could you stick your tongue out, please? We're going to continue your neurological exam, but I'll need for you to lie down.
To test sensations mediated by the spinothalamic tract, start with the ability to perceive pain. Using a fractured tongue blade, ask the person to close his eyes and say sharp or dull, depending on the sensation he feels. Then lightly touch the sharp point or dull end of the tongue blade randomly to his body.
Sharp. Dull.
Let at least 2 seconds elapse between each stimulus to avoid summation, the perception of frequent consecutive stimuli as one strong stimulus. The person should be able to identify each sensation correctly.
Sharp. Sharp. Dull. Sharp. Sharp.
Good. Could you open your eyes?
If the person's pain sensation is abnormal,
Temperature sensation.
test his temperature sensation.
Hot.
Fill one test tube with hot water and one with cold water.
Okay.
Instruct him to say hot or cold based on which temperature he feels. Then apply the test tubes to his skin randomly. He should be able to identify both sensations correctly.
I'm going to check light touch sensation. I'm going to touch your different parts of your body. I need you to tell me.
To test light touch, ask the person to say now when you randomly apply a cotton wisp to his arms, forearms, hands,
Now.
thighs,
Now.
and legs.
Now.
He should report feeling light touch in all points that you touched.
Now.
To test sensation mediated by the posterior
Now what
columns,
I'm going to do is I'm going to
start by testing the ability to feel vibration using a low-pitch tuning fork. After telling the person to indicate when the vibration starts and stops, strike the tuning fork on the heel of your hand and hold its base on a bony surface of his great toe and fingers. He should feel vibration or a buzzing sensation on these distal areas.